It has been almost 2 full years since the first case of COVID was discovered in the United States. Early on, you'll of course remember how everything shut down and restrictions were put in place. But since vaccines became available, we've largely gotten back to our old routines. Sort of. WCNC Charlotte's Chloe Leshner is at Novant Health with more on where the healthcare system stands now.
This Omicron surge has brought record-breaking COVID case numbers, hospitalizations, and percent positivity rates. But here outside of the hospital, not many people have changed their behaviors, and doctors say they're having to adjust as a result. The world has been on a 2-year roller coaster ride, and now North Carolinians are reaching another peak with the Omicron surge.
So it's safe to say we're not through the surge yet, and it's important for everyone to continue to try to do everything they can to stay safe and stop the spread of the Omicron variant.
The percent positivity rate in Mecklenburg County has been slowly creeping down, but is still above 30%. Dr. David Priest with Novant Health says even though the science has evolved over time, by now it's well known and data proves there's a higher chance of catching COVID in larger groups, especially when people don't have immunity. And COVID shots and boosters are the best way to avoid serious illness or death.
I think people kind of know what they need to do, and obviously they can choose to do that or not do that. And then in healthcare, we have to deal with the downstream ramifications of those decisions.
Widespread restrictions have not been in place for some time, causing healthcare workers to adjust to the new normal.
I think in general, American society is tired of the messaging, and many groups of people have simply moved on. So it behooves us in healthcare to have to understand that dynamic and make sure we have the resources available to care for patients who have complications related to COVID. And I think that's just kind of where we are.
Novant Health officials say across their footprint, there are 760 COVID patients in the hospital right now. 94% of them are unvaccinated or undervaccinated, meaning they didn't complete their series or they didn't get a booster shot when they were eligible. In Charlotte, Chloe Leshner, WCNC Charlotte.